Kwa majina yangu ni Daniel Mushoi Kimemia. Nimefanya kazi na shirika la Amref kuanzia mwaka wa 2008 mpaka wakati huu ambapo ni miaka 15. Nimekuwa nikiendesha magari tofauti na wakati walipopata hizi mobile clinic nimekuwa nikihudumu nazo mpaka wa sasa.
The idea of the mobile clinic was like any innovation, a crazy thought that came to our minds, and we were thinking about how do we reach the most rural communities. And we thought, a mobile clinic, but it had to be a mobile clinic that was addressing the challenges that were specific to COVID vaccination, the distance, the cold chain requirements, and that would be able to reach even places where there are no good roads. So once we had the idea of the mobile vaccination unit, as we started calling it, we looked at how do we build this out to understand what it would look like. We had a design, we drew it out, we took it to the fabricators and they built out the first prototype for us. And we tested it in different communities in Nairobi. We went to the informal settlements where the road infrastructure is a little bit difficult to just see if it would be able to maneuver. And when we saw that actually it is responding to the needs of the population, the people are able to access it, we learned a few things and we changed the design in little ways to respond to what we had found when we went to the field. And then we built 10 additional clinics, so we have 11 in total.
Access can be defined in many ways. It's not about the closeness of the health facility. It's where you can access in terms of your time, in terms of the geographical location, and even in terms of healthcare workers.
I would say that a community health promoter is the health worker at the front line in our communities. The main role of community health promoter, like the name suggests, is to promote health at community level, at household level. And when we say promote health, we mean educate communities, treat them for minor ailments, refer them when cases cannot be managed at community level or household level, as well as also be able to provide them with key messages. But they also carry messages also from the community to the health facilities.
Welcome.
Once Amref Health came to Kisii County, I had a different opinion about what it is. I thought it was the same old thing that we are used to. But when the concept was explained, questions were asked, discussions took place. I got to understand, and I felt this is my home. They're doing what I've been thinking. Where will I get someone so that we can go to the community to screen? Because the main thing is fishing out. That's where we are going wrong. We're waiting for them to come to the hospital.
Community health workers are very keen in preventing those diseases from occurring in the first place. So we continue with our advocacy, we continue working with our development partners, and we continue complementing the efforts that the government is putting in place to make sure that the community health workforce is well paid, is recognized, is motivated, and is enabled to actually discharge their mandate.
In some counties, we got such heavy co-creation that the governor and the political class were able to endorse the program and even take charge. They would give us vehicles, they'd give us their drivers and fuel their vehicles and their staff. And so it went as far as even some of the governors dubbing the program to tune their needs. So we had Lusaka, last mile access. And then we also had Mama Agnes, Achilo, Ayako, Mama Agnes, last mile access.
We work with them to understand what is the optimal route that we'll take where most people will be reached. So in certain counties, for example, they have a focus on things like teenage pregnancy, HIV, maternal mortality. Other counties, they're more interested in NCD screening, and those are the services that we provide in those counties. So it is very collaborative and very co-creative with government.
A county like Migori has seen, in the last quarter, they're #1 in the country in terms of cervical cancer screening, and they reached up to 193% of their target. And so it is not only the last mile access program, but it did complement their efforts, and they were able to meet their targets and their numbers of people they need to screen and HPV vaccination.
Globally, 82% of deaths are due to NCDs. 50% in Kisii County are due to NCDs. And most of our diagnoses are usually late. As we go around with the Amref Health MVC clinic, we hope to reduce the numbers. We hope our complications will come down as we do the early screening.
At the core, the mobile clinics are a solution for last mile access. This is a challenge that all the county governments, the national governments, many countries are struggling with. How do we reach the last mile?
The way we work is we strengthen the existing health systems with a sustainability lens. How can this continue even if the Amref team is not there? How can we get that ownership from the counties or from the governments so that they're able to run with it? So it has been a collaborative effort together with the counties, together with the sub-counties, together with the health teams, together with the political class, and even the population, the citizenry.
We are having many cases per outreach turning positive, either having diabetes, hypertension, asthmas, or cervical cancer. And when we get them early, we are able to refer them early and reduce the chances of these patients running into complications.
I can remember a man who had pressure of 270 over 180, that's an hypertensive crisis. Using the van of Amref, we referred that client to the level 4 hospital for admission. We also got another client who had high sugars of 26 millimole per liter, which is an diabetic crisis. Through the assist of Amref, we had to escort the client to the nearest health facility to be started medication.
When we think about the mobile clinics and when they go to communities, are communities really interested in the services? We ask ourselves that question, and the answer is what we see every day. When we go to communities, hundreds of community members come every single day to access services.
Community health promoters are not just a link, but I think the bond that brings the communities together with the entire health system. They are the first point of call, very well known to their communities. They understand their cultures. They understand the issues that really pain points of their communities. So they form a very important part. It could be a cog in the entire, population health wheel, where they are the people who will be the first to deliver messages to communities. They are the people who will be the first to interpret certain information that is coming from health workers at health facilities or the ministries of health.
And so some of the things that for me also really stick out are the numbers that we are able to reach and the lives, including here in Nairobi, where we think sometimes there is no access problem. But we've seen in Kasarani sub-county that we are getting a lot of traction in terms of the screening and in terms of access and reaching people where they are.
Today, having an outreach supported by Amref Africa. We're doing free service to the community. We're offering quite a number of services. To start with, they're doing COVID vaccination to the general population. We're also doing curative services to the community. We're also doing the HPV vaccination to girls from 10 to 12 years in schools. We're also doing NCD screening to the community. And all the other services are provided in the outreach. That will also create a good impact to the schools. Because you see, like now, most of the girls are at school. Time to coming for vaccination in the facility will be very hard. But now, with the support of Amref, going to the schools is the best thing we are doing. Because now we are getting, many girls are getting the HPV vaccines.
And we're also able to get consent from parents as the sub-county in the schools. So young children were able to be vaccinated for HPV with the consent of their parents and in collaboration with the sub-county.
My name's John Gashera from Dandra Health Center. I'm a community health promoter doing the duties of a mobilizer. We are in Dandra 2, area called 41, near Dandra 2 Health Facility. Because, you know, as a mobilizer, you have to have the passion of reaching out to those people, giving them the right message about the vaccines, about what you are doing. And then when you talk to them and when you have gone all around the village and all the estate, telling them that we are having the clinic and it's a free medical clinic. And when you see the turnout, you just feel great.
or kordata non metayle corona tor kordata o giralo tu leke aki olturur le Amref mobile clinic te konna okuliku moko inini ngana ke enkireshene sida yifa.
Okay, ore kiti anasia inaiki ata changamoto ni kumok oleng tangaraki ore enkop ormaasai na eton naduo kiti ababori tangaraki engeno neeku ore anasia naji nepuo ntomonok aiki sipitali nengasa aaku changamoto oleng amenyorra apa iltung'anak kumok kake kintareto neta egira aret ntomonok amu kepoito tata sipitali. Ore enkai changamoto nikiata na elakwani ing'ua enkang mpaka enkai kelakwanikino nkang'itie yare ewueji nilo kilomitani 10 iloito ake toonkejek na tenelo nesha neeku ikilaikino oleng aitabaiki iltung'anak onyama. Ore sii aitoki ilo nilo enkang nikijokini mpaka nilotu etii orpayian na orpayian elotu kaarie elotu orpayian nidol ajo kigol nira sii entomononi na kibidi ake piilo pitumoki atareto ilo marei nikiata apa enkata nikiata ng'uesin na iltomea nyoo kake kigira ake duo apuo ata etii nana niterua enkop aaning'en kigira ajoki niterutua sininche areto.
Mingo.
Karibu. Karibu.
Jambi.
Utoko.
Ya muno.
Acha mege.
Wala bombe. Ongela ve tu ta nyawari kyo indi. Ara. Uno mo.
Koko na mine.
So uno. Ne la ja mo be ta te gari ji. Ne bisi. Ora na ya ma ga anga mi na. Ki mo gari ji. Ngunon nibure anga mara ibur waro. Kote sasa kone miondo kwendi oldage. Kararan ngimut kwa hospital koba kepiman. Ngoe kerichek chekanam. Konde bare ker kora chiki ng'ololchini chebo komepima.
Yon karutechi en betut anyoru biik che nekit 40 besyo ko 30 makergei betusiek. Ako ng'alek chomwoini ko ng'alekab tililindo, mara ng'alekab TB, mara ng'alekab diarrhea, mara ng'alekab diabetes, mara ng'alekab kebal toiletisiek ak mionwogik kora che mara komi tuga akobwone biik.
Ngina mbuyore ineba no kwegura matangazo ayigarege sa kuna abantu banyore chanjo ya COVID-19.
Echanjo nje ya bi usangana ngebwatera neti sintagetimanga nayo
Ya yo mo ngina tege.
Yamonazo komboli rieta njengoro kwa Samuel Mukaya Masita injena community LT promoter CU Gekonge 2 unity li tanga ni konyora Amref mobile clinic go change na inje ko soime ne kra ya jete dispensary yitunsa abana kanyero ri alianza jinde ngoeta narora babegete ekambia so bakurwari abantu kine kra ya jeta ase itoke konga na naroje mobile clinic ya Amref amaragiria ng'ombe ane igutire na nje na imukie mufuko ne materials cyane nagende michi sita igasaba kuriria abantu ngakibagogete nondo utagete akonywe no eno ko mu advice kia akomenya twakwana nere uyu bwate muchando ndabwe nte ko kurigereri gwato muginya gitari na mutuma na ande na bwati gukinya gitari nga na iko na ande na korerwa muchanda bwate noera
Kanisa ngoenda ndi na nguchiga konge tukatanyori ripoti ya se kanisa sasa mungu kurukuturusira na Samuel na watatebetia se kanisa ngucha muri Samuel na konya tabantu igona bwate gasi ngutarare ngutemare kumanyi gutumanyi kende gyonse akarumu amotebire utoreteri ripoti taikaransira Seni wairire Mario tanguru kuteresa nyaboke menyatega konga no bone igasiane no kurima nasime gachingi ni chibando inere gasingo kora ya mugundu kurwa kwenda baka tauni kuchikurio munyagitari ni gasiengo nechine chibeso gutumia kuchikurio munyagitari na bora muri gitomonyora Amref yachirege igaseitoge konge yakonyira abantu barage konge yakonyira bangina abagaka na barunto tegete bache batachoini tupimo tuensi urero batari muntu amaboko rio sabangi na boko sa boko ria abantu bonse igo boruiro bwekero bwachire obo manye mapema ngo bwena buri lakini akara bwakorira singa kientambe utamanyeti mburi kuchukua bwena
wamate bwaito na barobwo no buya bure kiagera gero twabarifaire abantu gutyo abo bako bakorera muna twarika gose muna munyagitari ararore kiagera ntwiga cito is to suspect oyo na bara su twara marere amurigera marere amutomo gwikaria munyagitari okumwe examine onyoro uruira akoroteki abwata igo bwamate bwaito na banyagitari boro buya na ndekero muchando ure no nyine ma abande bangire kwenda clinic na bakwa kesim oteba mororo muntu gitana jita o Misiri obere default mubwati momoreta na goto kumubwati twamwira ni back to the treatment
kienda kingiyokte koba kobongoni line kotorot ko mara komanyor kerichek lakini ngiyokte raini kesip kekon sitoreni ngamun tinye kartasit nekang'eten gaa kesip kekere kartasit notet ak kikoi kerichek anan ot kot komami kerichek chotet kemwochi ele nyorundo ako ngiyokto mara kwo chemistry chenekit anan kesirchi kwo ele kacham inendet kocham kobo kora ko mwoe sipitali kole kakoit chichotet ako mwoe akine chito nekomioni kolelen kanyoru kerichek anan ko mara ko kanyor kerichek komi chemanyor kolelen kaal.
Whenever we have the elderly, the over 60 years, and where they get vaccinated and get their vaccine, and later on when we visit them with the household, they tell us how they have felt it is good, we have brought them a good service, and they get their pressure checked, and also we get good testimonies about this mobile.
We still have communicable diseases as issues in Africa, and now non-communicable diseases are catching up. And we realize that most of the time people walk around with these diseases unknowingly. And so there's that need to then integrate non-communicable disease screening and treatment within the primary healthcare system, and in general strengthen health systems.
So one of the ways that we're looking at that is how do we integrate NHIF registration into the mobile clinic, so that even as we go to the communities, we are talking to them about how they can be able to access NHIF and what NHIF covers, like any other clinic in Kenya. Then they would be able to access services, they can be able to pay using their NHIF cover to access the different medications that they need.
Tunawaeleza kuhusu screening, lakini wengi wao huwa wanaogopa, sababu wanaona kama nikienda niscreeniwe nipatikane nayo sasa nitakufa tu. So sisi tunawaeleza tu waende, but hapo bado tuko na changamoto.
Amref ina outreaches, inakuja inasaidia wamama, inafanya screening. Hata wale hawakuwa wanajua kama wako na diabetes wamejua kupitia Amref.
Kliniki yake rona soete ime ngiangoge narucha banyagitari baito bari smart bagatwarigani buya bari gutwiranira buya bari gutwebereri tugasoa bagaturwari buya batari gototogonyera baturubire tingora ngora paka tugakura paka tugeke stage yo gupimo tugapimo, yani batabwati bari gukonyera bagatupima buyaro baturwari tubuya twara betenga no bwoba, lakini nabo tuachiete tugasoa ime tugasoa room ya sister yo wa kwanza atevi soime mupimwe cervical cancer ikwa rahisi njabete rahisi gosoa nabo tuigwetenga no bwoba ngende njigupimwa na kingo enda njigupimwa, lakini tugatayaya tigatwenda tupimwa abanyagitari ke bachire bosa tigatasoa tupimwa tugasoa tugapimwa igatoka gusere timbu atiborweire ndisukuru ngateba asante se ntanyokanite kindwarite.
En kasini bo Amref anan kirutechin meng'ikab korik ko angandan ui achome ngamun miten tuguk chechang chebo kinete kok biik. Mara kong'eten chito neming'in ko mara makergei miondo nebo chito neming'in ak neo. Ele uyoito kora chito neming'in ak neo ko terter, so kironyoru kora kanetisiet en bichotet.
I have my job as a driver or a mobile clinic driver. Because when people are suffering, when I see them suffering, I feel that I should attend to them. So most of the time I'm with the community and the mobile clinic. I'm very happy working with the mobile clinic.
I'm blessed because I love my job, all because when I go out and tell the people on concerning the clinic and they respond, and I feel great.
Ore iltung'anak le Amref kata nanu naitaasa kulo tung'anak na matum apake enkai wueji ake naje. Ifundisha apa yiok kulo tung'anak esiai eishoi, neret yiok niteng'en apa yiok. Na ore nanu openy naa kanoto apa nakata, nebau enkata najing aji, neeku ore eton aipotu enkari peelotu enkari nebau enkerai ai. Ore amu eteng'ena apa yiok kulo tung'anak venye nikinko, nanu apake natii atua aji ai orpayian, naitumia ina ng'eno naishooki apa yiok kulo tung'anak le Amref, naret enkerai ai najing aji, etu naa atum enyamali pii, nikitum enkerai ang' asidai, nikintobiraa, neeku ore ena ng'eno naishoo yiok Amref mikitum apa ai wueji, amu ore paadol enkerai ai nadamu lelo tung'anak ajo aatareto.
We are always in partnership with our governments so that we can provide technical assistance, either in terms of technical expertise, funding resources. For example, we use a platform called LEAP for training of community, health workers.
This is the best innovation that Amref has brought to us in the community, and we feel blessed because this is an innovation that has made the community feel that now they are being recognized. They don't walk far, they get their medication around there, and it's free.
Kit necheron en kasini asi kobakora anete community kobo ng'alekab tililindo ko yon kororon borwek en biik keboisie momiten betut ne mara ko kelele makibera kasit, mara kakirutechi nekomyoni anan kakiib nafas neo ngamun tor komi mchango ne tugun chechang kekibongonjin chito nemyoni. Lakini yon miachen biik ketinye nafas neo nebo boisiet.
We will always want to send a message out to households and individuals and the larger communities. Otherwise, we are not going to achieve lasting health change for communities that we serve in partnership with our governments and our development partners. This is because community health promoters are the community champions.
And so some of the things that have come from this program include counties then recognizing that they might want to have permanently a mobile solution that then periodically goes to complement their existing systems so that they can hit their health targets. And we're looking at a way, creative, innovative impact financing that can be able to look at the impact that we are recognizing from this program and implement in a way that it will help the citizenry across board.
So long term, we would like to see the mobile clinics integrated into the primary healthcare system. We would like to see more services being made available in the mobile clinics. Services like portable ultrasound, portable x-ray, and thirdly, we would like to see the mobile clinic in many more counties across the country and in other countries across the continent.